Hey there, Dr. Alan Christianson here. I want to talk to you about parasites. Little things that could be squirming in your intestinal tract doing bad stuff. So what is a parasite? Well, it's an organism that feeds off of another organism. And in this context, we think about human intestinal parasites as being really relevant. They're living off of the host's expense, so to speak. And people now have talked a lot about them being one of the big root causes of dysbiosis, autoimmunity, digestive symptoms, many other maladies, and totally valid. There's something that can happen that you may have and you may not be aware of. Here's a really important big picture concept I want to draw out for you. There's many diagnoses that are real, that can be missed, yet they have a pitfall of being overdiagnosed also. And some of them can have many vague symptoms, and some of them can have no clear-cut diagnostic criteria. And the pitfall is that someone may think this is their problem, and even if they take reasonable steps to ameliorate it, they may think this is a lasting problem, and they may never really feel like they've shaken it. So this is one of these areas where it can be a pitfall. And the conventional side I've seen can go too far on the, oh, it didn't show up on my poor quality insurance reimbursed test, therefore it cannot be real. But the alternative side can go too far to say, oh, you've got any vague related symptom and we ignore all testing, therefore pretty much everyone has this and you may never shake it. We base the treatment solely off of symptoms. And the symptoms can be from other causes, so you could be on treatments for long term. So those are some pitfalls. Let's think about testing. So there are some simple tests that are done that most all doctors can order that certainly can detect the most severe, egregious parasitic infections. And that can include stool analysis, that can include stool antibody studies, and there's even blood markers. There's a type of a white blood cell called the eosinophil, or EOS, and some that have parasitic infections have severe elevations of eosinophils, like well up into the 20s and 30s and greater. Small elevations can be allergies, but the major ones can point more towards parasitic infections. And people can suspect them when they've got certain symptoms, abdominal pain, nausea, rash, loose stools, gas, bloating, general fatigue, antibody type responses, recurrent malabsorption of nutrients, say like iron, zinc, B12. These are all things that can point towards the presence of parasites. And validly, those who are tracking down thyroid disease, Hashimoto's, Graves' disease, or general autoimmunity, we've trained everyone to think about what are your root causes, and this can be one of those. Also, we can see things like restless, irritability, unexpected hunger, rectal itching, recurrent yeast infections, IBS symptoms, odd cravings like what's called pica, where people crave non-food substances like dirt or clay. And those at highest risk would be parents of young children, especially those who are in childcare settings. Also people who have pets and manage the pets and their pet poop and clean that up. Children in childcare centers and childcare workers, farm workers, also around bigger pets, so to speak, and then those of us who can be out in the backcountry being exposed to untreated waters. Those are the main groups that can get that. And parasites are harmful because they tie up a lot of your immune resources. There's this thing lurking inside of your body's trying to get rid of, but it may not successfully be able to do so. And that can also make it to where you're malabsorbing key nutrients and you're developing food intolerances and losing many of your good bacteria. So those are the main categories to think about. And in terms of action steps, if someone does have autoimmunity, malabsorption, digestive symptoms, it's really worth a good screen. It's worth doing some tests to see that. The more common tests look for antibodies to a small number of bowel infections or parasites. And they're accurate when they're positive, when they show a problem, but they're not always accurate when they're negative. So this is a weird thing, but in medical testing, by and large, think that positive is good, that positive is bad, negative is good. Normally we mean negative like, oh, he was a negative person. But no, in medical testing, negative means no, there were no findings. Positive means yes, there were findings there. And we talk about how often tests can be mistaken. And notoriously, tests have a higher rate, in most cases, of more false negatives than false positives. So if a test says you've got parasites, odds are pretty good you've got parasites. If the tests say you do not have parasites, well, that's not as definitive. There's a chance you still may have parasites. It can still happen. So if you test, if you've got a lot of strong symptoms and you take a test and the test is positive, that's straightforward. You'd want to treat and resolve those. If the test is negative, a thought process should be, what else could be causing these symptoms? And let's check for that. If there's no other explanations, doing a short course of treatments for parasites is not unreasonable. There are conventional and there are natural treatments. Mebendazole, one of the mainstays of the conventional world, is popular. There are also many others, none of which are innocuous, nearly all of which don't make you feel well while you're taking them, and they can harm your good flora and create other issues. So I really wouldn't do the conventional medicines if there was not a clear positive diagnosis, if you didn't know which bug you were dealing with. On the other hand, some of the alternative treatments like Artemisia, black walnut seed, herbs like berberine or triphala, these are things that are safer to use. And I wouldn't say perfectly safe for long-term use, because they too, at the extremes, could hurt your flora, and they could also be a factor developing resistance. So there's data now showing that, yes, herbs can make resistance amongst bacteria in your flora and low-grade bad infections. So don't take them forever, but a course of a few weeks, not unreasonable. And if a few weeks of an herbal treatment leads to a clear change in immune markers, antibody levels, nutrient absorption, that's awesome. But if it's more purely for some of the vague symptoms and they get better, that's also fine. But if they don't assume you've got to do it longer, because at some point you could tax your system. That's a case where you do want to work with a naturopathic doctor who can really help you find the root cause, or a functional medicine practitioner if nothing else, and sort out what is behind this and address that and be done with it. By and large, you don't want to be doing long-term prolonged treatment when there's no clear way to say this is the problem and no clear way to say you've actually gotten success, you've actually gotten it taken care of. So a little more about parasites. Hope that context is helpful. We'll talk again really soon. Bye-bye.